You are watching Talkland. Welcome in Glimpses. I'm your host, Dr. M. Azam. We have Asif Khan Saab with us. Today, we are going to discuss a very serious matter, a very critical issue. He will introduce himself about this. He had a chronic illness. So, sir, welcome in the program. Please let us know about something.
I had suffered from multiple diseases, and the fatal one was cancer, and that was not one but two. One was lipoma. It is also very serious, and it was in a fourth rate condition. And then I had a colon cancer. Simultaneously, this is very rare. You don't find in normal people. It happens in thousands and thousands one of among thousands and thousands. So I was diagnosed this disease suddenly and very. It was very strange for me because I was leading a very healthy life, very normal life. I was continuing with my exercise, with my diet and everything. And I was running as usual, as my exercises were also very okay and good. But suddenly I had a slight pain in my upper and lower stomach. It's just normal, it's just a gastric disease. And it will get all right by taking normal medicines, digestive medicines. And I took those medicines regularly, but that disease, that slight pain in my abdomen, that kept on increasing, slightly increasing and then increasing more. And during exercise, it used to increase.
Okay, okay, fine. Okay, so when were you first diagnosed with your first cancer?
It was a news for me also, Dr. Saab. As I've told you, I had a slight abdomen pain, but it was not that serious and that severe that I should be diagnosed as a fatal disease of cancer. But anyhow, to be very on the precautionary side, on the safe side, I went to the gastrologist. I went to the leading gastrologist of Lahore, of Pakistan. That was Anwar Ahmad Khan. And he was already my doctor from many years back. I used to consult him because I was facing certain problems of digestions. So I went to him and I told him that I have this problem, I have a pain. So he advised me that we should go for a colonoscopy. And I don't hope there is anything wrong in that, but still to be on the safe side and still to be taking precautions, we should go for gastrology.
Okay, so do you remember the exact year or what was your age at that time?
I think it was 2015. And you can imagine it was 10 years before this. I must be 60, 62 at that time. But that was also a very mature age. So I went to the doctor and he advised me for colonoscopy. And he did his colonoscopy. In colonoscopy, he did find some things abnormal, but he was quite confident. He said that I don't think it's something very serious, but there is something, and let's go for a biopsy and let's see what the laboratory tells us. But I have seen some things extraordinary there, so we must go for a laboratory test.
And how did you react when the doctors told you about it?
It was quite normal, but I was confident that because I was feeling all right and feeling strong and healthy, the normal symptoms of cancer are you lose your appetite, you lose your weight. But I was not losing my weight and I was not losing my appetite. I was feeling hungry. I was taking normal diet. So I was not that worried about that.
Was it easy or difficult for your family to hear this news?
Yes, after about a week or so, the report came, and that said there are certain cells which are malignant and that require further treatment and further procedure. So the oncologist, my oncologist was a very well-known, renowned oncologist, Dr. Arif. I was recommended by doctors to consult him. I went to him. He said that there is a disease, and there is a disease there, not very serious, but cancer. All cancers are serious, and it is in a very advanced stage, and we have to deal it very aggressively, offensively. And I'll recommend you to come to me, and for we have to you have to go for chemotherapy session, and those are very painful sessions, and I don't know how long it will take, but it will go on for a fortnight. After every fortnight you will have a chemo session, and I hope that your disease will get all right by 6 chemo session, but normally we might prolong it to 8.
All right. So when you first felt the symptoms, then how long did it take to reach the diagnosis? There was a lot of time which passed when the symptoms appeared and the diagnosis was made, or it was diagnosed soon.
No, after the laboratory test, it was diagnosed abruptly. A laboratory test was quite clear. There were symptoms. So my treatment was started after 13, 15 days after the laboratory test. So I undergo for a first colonoscopy, and then onwards every fortnight I used to have not colonoscopy by chemotherapy. And chemotherapy, Dr. Saab, is a terrible, it's a very terrible thing. Normally it looks very normal. The medicine goes into your blood by ordinary means, by your blood, by what you call that?
Intravenous?
Intravenous. Intravenous, the medicine goes in, but after effects are very terrible, very horrible. You lose appetite, you lose sleep, you lose everything. You get weak, you don't feel hungry, and you are awake all the time. The after effects are very terrible.
Okay, so among the procedures were chemotherapy, biopsy, colonoscopy. Were there other medical procedures also involved?
This was the first phase. I went on for chemotherapy. It continued for 5 sessions, and I opted for a good medicine. Doctor told me that we can have a medicine which is cheaper, but I told him that this is a health matter, and health is supreme, and we must take no risks. So we go for advanced medicine, and we took very advanced medicine. And there was 5 sessions. After 5 sessions, he told me that I think it's enough. Then we should go for another test. That is a test it's very rare, and it is very less in Pakistan, hardly in 2-3 places of Pakistan. One is in Shaukat Khana, one is in Mole, and one is in hospital, Aga Khan Hospital in Karachi. So there's a lot of rush. They call it a PET scan, and they take you in a in a machine. That machine is a very huge machine. You can go inside that machine, and that machine is a zero temperature. They are very cold, and you feel really very cold. You have to put your warm clothes before the test. So I underwent that test. They give you a medicine. That medicine is a green medicine, and it goes into your body. And if the symptoms are there, it lets you know after the PET scan and that the symptoms are still there. And if it is removed, then your PET scan is quite clear, and you come to know that the disease has been finished and it has been eliminated, and you are perfectly all right now. But unfortunately, my PET scan pronounced that you still have a disease, and that disease is still lingering, and there are signs in your body that cancer effects are still in your body. So that was very astonishing, very surprising, very discouraging, very disappointing. I went to my doctor. He was also very disappointed. He said to me that I gave you the best possible treatment. I was not expecting that, and I don't believe this machine. Let's go for a retest, and let's go for a re-examination of your report.
Okay. How long did your overall treatment last?
After he recommended me to go for a retest, I went to the doctors again at Mole. I consulted the head of the department that my oncologist had advised me for a retest and to re-examine. The reports are not very clear, and the doctor is suspecting that it is not clear and it is not perfect. The head of the Mole department was surprised. He said, "We have the latest machines, we have the latest operators, and normally our reports are perfectly all right. But to satisfy you, we'll go and we'll recheck and we'll re-examine your reports, and we'll let you know after a fortnight." Then after a fortnight, they came up with the same reports. They told me that reports are all right, you still have a disease, and you better consult your oncologist.
Did anyone, maybe some of your family members or your friends, advised, or you yourself thought to go abroad for better procedures and treatment, or more advanced treatment?
There were two views. One was that we should go abroad, we should send our reports abroad. And second view was that we should consult the quacks, and some people were mentioning that we got all right by quacks, and you go to some village near Miyawali and you can get treatment. Many people got all right by taking his medicines, and you should also try that. It believes in local medicines. But as a scientific man, as an educated man, I didn't opt for that Desi Ilaj. I refused, and I straight away refused it. As far as foreign consultation was concerned, I was quite satisfied with the doctor. He was an American educated doctor. He used to practice in America for 6 months and then in Pakistan. And he was American board qualified and highly qualified. He headed Shaukat Khanum cancer department for 3-4 years as a head of department. His results were quite satisfactory. So I had a confidence in my doctor. He told me that let's see what's there inside, and let's re-examine again. And he opted for biopsy. He tested. I went for colonoscopy again, and then again my reports were sent to the laboratory, and unfortunately my reports came positive. I was suffering from colon cancer. And that was something separate from the lipoma, which I had suffered earlier. This was a separate disease, and this was related to my colon, to my guts. I had a colon cancer.
Okay, so what was the time gap between the diagnosis of two cancers? After the first one, how long did it take when the second one was diagnosed?
Hardly 3 months, slightly more than 3 months. I was diagnosed by a second cancer, colon cancer. And he told me that colon cancer is not very dangerous. It can be, you can remove it by surgery, and you have to go for surgery. There's no other way to deal with the colon cancer by chemotherapy, by medicine, by other thing. You have to undergo for a surgery, and that will a surgeon will advise you how can he will be able to do it.
So it is amazing, and it is very surprising that you survived two cancers, and your doctors must also be surprised. So what are their views about you? I think you have very strong nerves.
Yes, after second cancer, I was a bit disheartened and disappointed, and I consulted other surgeons and other people also. They all told me there was a unanimous opinion that I will have to go for a surgery. There's no way out. Cancer only can be eliminated by surgical operation. And so I opted for the best possible surgeon in doctor's hospital. That was a team of surgeons, because one or two surgeons told me that this surgery is very precarious and very serious. You will be permanently deprived, and you will be disabled. You will be carrying a bag uh, with you in stomach, and you will not have a normal stool onwards. And that was a very shocking and a very disappointing news for me. I lost, everything. I lost everything by when doctors told me that you will be permanently disabled. So I wanted to fight out. I wanted to live a life, a healthy life. And I was really disappointed, shocked that I will live a miserable life, and I cannot live that life. How will I lead that life carrying bag with me and not able to pass my stool? So I consulted the best possible doctors. That was in doctor's hospital. One was Azhar Mahmood and was Dr. Varis. They were the leading. They had a team about 4 or 5 doctors, and they told me and that no, we will 100% cure you, and you will not be deprived of passing stool, and there will be no bags. We'll try to do such a surgery that by bypassing everything, you will become a normal. So my first surgery, as I've told you, that was 5 hours long. I had 5 bottles of blood denoted by different people from my nephew's friends. And second, my surgery was also very long, and that was also more than 5 years. Doctors cut my stomach, opened it, and they did not then stop there, and they took my tests, and they consulted the oncologists, they consulted the radiologists, and after getting 100% surety that this cancer is limited to the colon, and my colon was removed. And after the approval of the oncologist and radiologist, that this part of my colon has been affected seriously, when it was removed, and when they were satisfied that it has been removed, then my stomach was tied down, and the doctors finished my surgery. It went on for more than 5 years, 5 long hours. Thank you.
I see. All right. Um, I, I was thinking many patients whose willpower and heart are not very strong, despite all the treatments and procedures, having good doctors, some of them cannot even survive. And those who survive, many of them cannot avoid the worst consequences of such diseases. So it is amazingly surprising that not only you survived, but you avoided all the bad, worst consequences of these chronic diseases. So after it obviously the treatment, the medicine, the procedures, the doctors, they played their part. But I feel your willpower and your faith in having a better lifestyle, in making exercise, reading books, all that, it must also have played a part. So, what do you think? What what percentage of your willpower and good lifestyle played this part that you avoided such bad scenario and bad consequences of your diseases, and what percent played the part the treatment and all that?
You're right. This was a very fatal and devastating disease. And when I was put in intensive care, the patients along with me of cancer, most of them died onwards. And it was very miserable. And my condition was also very bad. And most of my family members also have lost hope. My friends have lost hope. But I was courageous. I was in high spirits because I wanted to live. I wanted to live long. I wanted to do something else in my life. And people's prayers are also with me because I led a very normal and very peaceful life. I didn't hurt anyone. And I supported everyone, the poor, the downtrodden. I supported them in life. So their prayers were with me, my parents' prayers were with me, my friends' prayers were with me. And my stamina was also that I should keep on fighting. Life is only given to you once. And when you die, then you're almost finished. And I must not die, I must face it. And there are diseases in which people survive. And if I have a fatal disease, and that was very uncommon, two kind of cancers, and both were in fourth stages. Both were very serious and very, in a very bad position. And I had gone very weak, very slim. I was not taking anything. My hair has been removed by the chemotherapy. I had no hair on my head, on my face, on my eyelids, and that was a miserable part. But I kept my spirits up, and that spirits gave me life. And by a miracle, you can say it's a miracle. Normally, it doesn't happen, as I've told you. I had patients along with me doing chemotherapy with me in intensive care. 90% of the people have died. They died. Hardly 5 to 10% lived, and I was one of them. So I was lucky and I was fortunate.
Ladies and gentlemen, Asif Khan Saab is telling us a story of cancers. And it is obviously a very inspiring story. So, sir, let us please know that how long did you have to take the medicine? Or does it still continues your treatment, your procedures, your medicine, or you have stopped it?
Dr. Saab, there are many views of oncologists. When my colon cancer was removed, most of the doctors told me that now you're all right, you should lead a normal life. But my own doctor, that was Arif Chaudhry, he told me that let's go for a precautionary measures, and you have to do follow-up for at least minimum 6 months by taking oral medicine, and that medicine will come from Dubai. Those are imported medicine, and those imported medicines were quite expensive. I went those medicines for 6 months, and after 6 months, he told me that now it's almost finished. But there were two views, as I've told you. One was a very conservative view of oncologists, the pioneer of oncologists, Dr. Zeba. She sits in Latif Hospital, Lahore. Firozpur Road. She's also a very leading, rather pioneer, and the first doctor of oncology in Pakistan. She told me that you have to go for a follow-up throughout your life. This will not, even after 10, 20 years, people come to me, the recurring of disease. So you have to follow. But my doctor told me that I'm quite satisfied with you by your progress, and I give you 5 years to follow up. 5 years you have to follow up. After every 3 months, you have to have a blood test, RFT test, LFT test, and other tests, and you have to come to me and show to me that the disease is not there anymore. So I went on doing that practice for almost 5 years, and after 5 years, he gave me a green signal that you're all right. Now you can lead a normal life. But one other incident I have forgotten to mention you, and that is still persisting, and that is will go on for to me to my grave. After my second surgery, which I told you was for 5 years, 5 hours consecutively, my whole of the stomach was cut, and the oncologist and radiologist came, and when they determined that the disease is no more there, then the doctors went for the stitches. But one fault was left there. They after this surgery, they put me on bag. Bag is that for some 10 to 8 weeks, you cannot pass your stool normal by normal procedure. Through bag, your stool will pass. So 8 to 12 weeks, I had that procedure also. And after that, then they went for another surgery that is called a reverse surgery. Then they removed the bag and they tied. They removed the bag, and the normal procedure of stool passing of stool takes place. But unfortunately, and that is also very rare, and in very few people, handful of patients, that a slight stricture remained there when they did my reverse surgery by putting me out of bag. And it is just like a skin. If you rub a skin, and a skin comes out, a slight skin comes out, and that remains there. So after that surgery, that skin came up, and there was a blockade, and that blockade stopped my normal stools, and I had a passage of stools just like 10 to 12 years kids, and that was also a very painful thing. But after having a very serious disease, and after going through a life-threatening disease, I thought this is secondary. I will live with this. And diagnosis for this was dilation. I was recommended dilation after every 10 to 12 weeks. And that dilation was through colonoscopy. And they used to dilate the space, and they used to, by putting balloon there, you used to increase that space that my stool should pass normally. So this practice is still going on, and it has not been fully cured, and I'm still living with that, and I'm using laxatives, a lot of laxative to pass my stool, and I'm not able to have a full diet, to take my full diet, but still I take diet, healthy diet, and I live on. I do my exercise. I'm active. I have come up to my old routine by exercising, yoga, and my gym and everything that is going on normal. But this handicap is there, and I have to live with that. And I have made my mind. The doctors have told me that it is not dangerous. And this is not dangerous, but there is a fault, and this can be only removed by a surgery again. And doctor of surgeries were so painful. I had 2 or 3 surgeries. I was determined not to go for third or fourth surgery. So I decided to live with this disease, with live this being handicapped. Still, I'm normal. I'm taking diet. My reflexes are all right. My stamina is all right. So I'm leading a normal life with this problem, which is still persisting.
All right. So obviously, it must have affected your social and political activities, or did it stop your activities altogether for years?
No, it did not stop me. I had as I've told you, I had a stamina and I had a life dream. I wanted to live long. I wanted to do something. I wanted to do something for the society, to remain in the society, to contribute something positive and productive to the society. So I continue my activities. The slight drawback is there that I was fond of traveling abroad. I used to go to Europe. I used to travel to Far East and other countries. But now I don't have a stamina. I can't go by air because I have to take laxatives and a lot of laxatives, and I go to washrooms time and again with a very short interval. So my traveling life has been decreased and it has shrink. But I can travel to on motorways because there are very good 5-star washrooms on the motorway. So I can travel on motorways. I can travel to Lahore. I can travel to Islamabad. I can continue with my positive and creative activities.
All right. So, how did your family members, your political colleagues, and friends support you during this period?
Doctor, there was a lot of prayers in abundance. Lot many people prayed for me because there was such an unexpected disease. It was such an unfortunate. Nobody was expecting that because I was leading a very normal, healthy, and robust life, and no one was expecting. Not my family, not my friends, and not anyone who knew me. So this was very disappointing for them, but they were very delighted and they were gladdened when I was rehabilitated and I was restored. I got my health better and everything became normal. So this was a great news to me and for my friends also. So I'm continuing my normal activities. Normally, I don't tell them. My colleges told me that don't tell other people, strangers, that you suffered from such a terrible, horrible disease and your disease was such a chronic. Don't tell you because you're a normal and forget it. Forget that disease and lead a normal life.
So, did you have to follow a strict diet during treatment?
No, doctor didn't advise me to take a strict diet, but I take less. I take proteins. I take good food, healthy food. I take nuts. I don't take carbs and I don't take rice. I take less sugar. I take less bakery. Not totally eliminated, but I take less. I am a bit cautious about that, not to take sugar and other things which are abundance in carb and which are not good for my health.
Were the medical expenses very high for this treatment?
Dr. Saab, now things have become a bit cheap, but at my time, say 10, 15 years, 12 years back, 10, 12 years back, it was very expensive. It was very expensive. I pray that people don't get this disease. This is a rich man disease. Poor people cannot afford it. The chemotherapy is very expensive. The medicines are all imported, and they come from Dubai and out of the country, and they are not subsidized. Now they claim that they have been subsidized, and they claim there is a subsidized treatment in Karachi and many hospitals. But I don't totally agree with that even. So this is a very expensive disease. It comes in millions and millions of rupees.
Who was your biggest emotional support during this fight against the disease?
My family, my friends, my colleague, my comrades, they supported me. They were with me all the time. They were praying for me. They provided me strength. But as I've told you, I myself was in high spirits. And when they used to see me in high spirits, they boosted me and that you're a strong man and you will overcome this disease and things will come normal soon.
What role did your family play in your recovery?
They supported me morally, financially. They were at my bedside, encouraging me. They really supported me. They were quite encouraging. My friends also, my family also. And there were a lot of prayers, as I told you, of the downtrodden, of the poor people whom I have served. They all supported me. And I had in far of my mind that with their prayers and with their moral support, I will survive this killing disease and I'll get normal. I'll go back to my normal life. And now you see me, I'm leading a very normal and healthy life.
Okay. What did doctors tell you about your chances of survival?
Actually, doctors are always optimistic. They don't tell you that you're going to die. Nobody tells you. That's not the hobby of any successful doctor to tell his patient that you will not live long. But because the results were coming up and it was a stage disease and I had lost plenty of weight and I had lost plenty of blood. I was skeleton. I was very weak. I was not eating anything. So the chances of survival looked very dim outside, very bleak among my friends. They didn't tell me that. But afterwards, when I got all right, when I became healthy and normal, they told me that we have lost hope, that you will not live long. You're a guest of few weeks. But as you see me, I am all right and I'm leading a normal life.
When you went under surgeries and you had to go through the painful procedures and tests, you might have to stay in bed for several days without even touching the floor. So maximum how much time, days or weeks you had to stay in bed continuously? Even you could not go to washroom.
Dr. Sabir, it was weeks, hours, weeks, months, and I can tell you even years. I became normal. My disease took about 3-4 years. I became normal in these 3-4 years. I led a very miserable and a very devastating life. The life was standstill. I couldn't eat. I couldn't normally go or to my washrooms. But the courage was there and the stamina was there, the willpower was there. When I was out of pain, I used to read. I used to read books when I was out of pain and when I was not asleep. So I kept myself busy on my sickness also, not to lose hope and to live a normal life as far as it's possible.
How did it feel when the doctors declared you cured?
It was amazing. It was amazing. It was a dream. It was a dream. When they gave me a green signal that you're all right and the disease has been thoroughly eliminated, and you can lead a normal life, and you can go and enjoy your life. So that was a dreamlike situation, and I went home and started my normal life. I started my politics, I started my reading and everything. Except that dilation, that blockade, that laxatives, that was a little bit hindrance, a little bit obstacle in my normal life. But because I had a very painful experience and very bad experience, and so I thought that it's all right. This is less. This is less painful. This is not painful at all. So at least I'm leading a normal life. I'm eating. I'm enjoying. I'm moving around, and I'm playing my normal role in my life.
So, did this experience change your view on life?
Yes, definitely. After this chronic, life-threatening disease, when you get a new life, then you really think that your life is very expensive, and you come here once, and it's better to take full benefits of this life, to deliver in this life, to be useful to human beings, and useful for the community, useful for your family, for your friends. And you should be very positive, constructive, and you should play not a negative role, but a positive role in the society as far as you can live now.
Did it change your perspective on political work and ambition?
Not much. I had a political vision, and that my vision was uh, more of the left leaning. I was more inclined towards labor. I was more inclined to pro poor, pro woman, pro minority. So I had these views, and they were well entrenched in me, and they are still continuing, and I'm going on with these views, leading my life as a progressive, as a modern and secular human being.
Do you think stress from political struggle caused your illness?
I cannot say that it was such a astonishing and such a surprising. I was not expecting this disease because I was leading a very healthy life, healthy diet and exercises and everything. There was nothing unusual in my life. I didn't smoke, and I had no such bad habits. So I was not expecting that I'll get such a disease in my lifetime, because it happens. It happens. It's very rare. It happens. It happens in my family. It might be genetic also. My sister died by cancer. Two sisters died by cancer. My cousins and uncle died by cancer. So this might be a factor, a genetic factor. You cannot rule out that. Genetic factor might be the main cause of my disease. Otherwise, I'm leading one very normal and healthy life.
Other than genes, what doctors tell can be the causes or the reasons of such diseases?
Doctors were themselves astonished, and then when they talked about, discussed with me my normal life and my usual habits and everything, and then they told me that this simultaneous cancer is very rare, and both fatal are absolutely very rare. You don't find in normal, in a thousand and even lakhs of people. You can't get that people suffer from simultaneously with two cancers. And this was also a very news for them, and they had a experiment by treating me. That this gentleman, this patient, is living with two fatal cancers.
What advice do you give to people fighting serious diseases?
Uh, I give people that you should not lose hope. Never lose hope. You must see that God is with you, and something is going to help you, and nature will help you. Nature will cure you, and all fatal diseases are not all that fatal. They can be cured, and they have been cured. And there are few diseases like lung cancer, liver cancer, that is very miserable, and you can't live with that diseases. But other cancers, there are hundreds of other cancers, and many cancers are not benign, not less malignant, but by advanced treatment, by nice treatment, by confronting them offensively, you can control your disease.
How do you feel about your health and energy today?
Dr. Sabha, I'm perfectly super fit. I had a 1 hour cardio in gym. Then I went to stadium, open air stadium, grass, green grass, and there were a lot of athletes, youngsters, people 50 years younger than me, more than 50 years younger than me. They were practicing. They were practicing for the national games. They were athletes of national standards, of different colleges, of universities. Girls were also there. So I went there also. I went for strides of 50 meters, about 5-6 strides. I went for stairs also. And you can see my total workout today was nearing 2 hours. So this is a workout of a very healthy and middle-aged man, not a man of 70 and above 70.
What do you feel it is? Why do you feel it is important to share this story publicly?
I want to bring people ray of hope, because if you get dissatisfied, and if you lose hope, and if you think that the disease has overcome you and you will not survive, then you have very little chance. I just wanted to tell them that for survival, to overcome these fatal disease, you have to build stamina, you have to build courage, you have to have a positive view of life, you have to be very productive and think that this life is once and you will live long, and you have to fight with this disease, and these diseases can be overcome by your courage and by your treatment.
So my last question today would be, did you learn any important lessons for a healthy life? Did you change your lifestyle, routine, and habits accordingly?
I was as I've told you, leading a quite normal life. But now I become more health conscious, and I read more books about health and about my cardio health and my other health. So I take less diet, I take more protein, I take less carb, I take less sugar, but I take healthy diet. I take everything. I take meat, I take fish, I take even what you call beef. I take beef also, and I take everything which have proteins. Nothing. I don't abstain from anything except sugar and bakery items.
Ladies and gentlemen, it is quite an inspiring story. Asif Khan Sahib has told us about his chronic illness, about his double cancer. So he was diagnosed with cancer twice, and not only he survived, he has avoided the worst consequences of those very dangerous diseases, partly due to the treatment and largely due to his strong willpower. So, sir, thank you very much for your time, and see you in the next episode, inshallah. Ladies and gentlemen, thank you very much.
काफी देर हो गया, लेकिन थोड़ा अच्छा लेंथी हो गया, एक चैप्टर से कवर कर लिया है।
जी बिल्कुल। हाँ, मैं जैसे कि डिटेल आनी चाहिए थी। हाँ,
2 घंटे